Welcome to the Plastic Surgery Playbook.
Glad to be here.
So, imagine running into an old friend you haven't seen in like 15 years.
Right.
They walk into the room and they haven't aged a single day.
It's wild when that happens.
It is. And, you find yourself looking closely at them. There are no visible scars, no suspiciously pulled skin, no unnatural wind tunnel look around their eyes.
Yeah, they don't look like they've had surgery at all.
Exactly. They just look perfect. And for decades, that level of invisible, truly seamless plastic surgery was considered almost impossible.
It really was.
It used to be this trade-off, right? Like you could look younger, but everyone would know exactly why. You'd have the tight look.
Oh, absolutely. The secret would be out.
But today, that seamless result is the standard. So how do surgeons actually pull it off? How do they reconstruct a face without leaving a trace of their work? That is our mission for this audio.
It's a huge topic.
It is. We are going to demystify facial rejuvenation by exploring the technical and aesthetic differences between a standard traditional facelift, which is often called a SMAS lift, and the highly advanced deep plane facelift.
Right, the two big players.
Exactly. And we have pulled some incredible insights from top medical journals and leading facial plastic surgeons across the globe to really figure this out.
Yes, the research on this is just fascinating.
And our primary source guiding our understanding today is Dr. Shim Ching. He's a highly regarded plastic surgeon who practices in Honolulu, Hawaii.
He's fantastic.
He really is.
Right.
His extensive work on facial anatomy and surgical technique is going to, well, completely change how you view this entire process.
What's fascinating here is that the ultimate goal of modern plastic surgery has undergone a radical shift.
Oh, for sure.
Because the benchmark for a successful procedure is no longer simply, removing wrinkles or pulling things tight.
Right, the old way.
Yeah, the true mark of success today is looking completely fundamentally natural. The objective is to make you look as if you've simply reversed the clock by 15 years without leaving any visual evidence that a scalpel was ever involved.
Which is an incredibly high bar for surgical artistry, honestly.
It really is.
Okay, let's unpack this, because before we can even begin to understand these advanced surgical techniques, we really have to look in the mirror and understand what is actually happening to the face as it ages.
We have to start with the foundation.
Exactly. And honestly, to appreciate where we are now, we need to look at how early surgical attempts got the anatomy completely wrong.
Oh, they got it so wrong.
Right. So what is the actual structural breakdown of an aging face?
Well, it is a persistent misconception that aging is just about the skin surface getting wrinkled or, losing elasticity.
Like it's just a surface problem.
Right, but that is merely a symptom. The aging process is fundamentally a structural collapse.
A structural collapse. Okay.
Yeah, as you age, you experience a significant loss of volume in your face. And that means particularly the degradation of bone and the shrinking of fat.
Oh, wow, the bone actually degrades.
It does. And at the exact same time, the deep fat pads in your cheeks begin to physically descend. They drop.
Gravity doing its thing.
Exactly. And crucially, your retaining ligaments, which act like these internal tethers or anchors holding your facial tissues tightly to the bone, they begin to stretch and weaken.
So the anchors literally just give out over time.
Yeah. If you have ever stood in front of the bathroom mirror, placed your fingers on your cheeks, pushed the tissue upward, and just wished it would stay there, well, you are literally witnessing the failure of your retaining ligaments.
I feel like everyone listening has done that mirror test at least once.
Oh, absolutely. Gravity is relentless, and it is just pulling that entire foundational layer downward.
Which, honestly, perfectly explains why the earliest facelifts performed about 150 years ago were such spectacular failures.
They really were a mess.
Yeah, Dr. Shim Ching talks about these early attempts, and they were essentially skin-only lifts. I think there's something that's called subcutaneous lifts.
Yes, subcutaneous, meaning just under the skin.
Right. And the surgeons would quite literally just lift the skin off the underlying tissue of the face, pull it back as tightly as possible toward the ears, cut out the excess skin, and sew the edges back together.
Which sounds terrifying.
It does. And Dr. Ching is very vocal in pointing out that this method flat out does not work.
It doesn't, because the human skin is an incredibly delicate organ.
Right.
I mean, it is simply not designed to act as a structural hammock. It cannot bear the heavy weight of those deeper, sagging fat pads and muscles.
It's just too fragile.
Exactly. When you attempt to use the skin as the primary support structure for an aging face, the results are notoriously short-lived and, frankly, aesthetically disastrous.
I was actually trying to visualize the mechanics of this, and the best way I can describe it is Um, to think about a fitted sheet on a bed.
Oh, that's a good way to look at it.
Right. Like imagine taking a thin silk sheet and pulling it as tightly as you possibly can over a lumpy broken mattress where the springs have totally collapsed.
The springs being the fat pads and muscle.
Exactly. Sure, you might manage to smooth out the surface for a moment, but all those foundational structural issues of the broken mattress are still sitting right there underneath.
And you can't hide that for long.
No, you can't. And eventually, the immense tension is just going to rip the fabric of the sheet.
Which is exactly what happens to the skin. It stretches.
Right. But my brain immediately goes to the timeline here.
What do you mean?
Well, if pulling the skin tight creates that dreaded stretched look and causes terrible wide scarring around the ears because of the constant tension, why did it take so long for the cosmetic surgery industry to finally move deeper into the face?
Right. Well, the delay was entirely due to the extreme danger of the underlying anatomy.
Danger, like hitting a nerve.
Exactly that. The deeper layers of the face are a treacherous, complex web of nerves, muscles, and glands, most notably the facial nerve.
And that's the one that controls expression.
Yes, it controls every single expression you make, and it runs right through this territory. Operating in those spaces requires an unbelievably profound understanding of three-dimensional facial anatomy.
Just to avoid causing permanent paralysis.
Precisely. It took decades of careful anatomical study, trial, and surgical refinement for the medical community to not only realize that gravity primarily affects those deep foundational layers, but to actually invent a surgical approach safe enough to manipulate them without destroying the patient's ability to smile.
Wow. And that hard-won realization is what birthed the traditional standard of modern facelifts.
Yes, the SMAS.
Right. To fix the massive tension problem of those early skin-only lifts, surgeons finally went one layer deeper. Which brings us to the SMAS.
The SMAS stands for the Superficial Musculoponeurotic System.
Which sounds very intimidating.
It does, but it is essentially a fibrous, durable layer of tissue that lies right beneath the skin, but sits above the deeper facial muscles and fat pads.
Okay, got it.
You can think of the SMAS as the structural scaffolding of a lower face.
Scaffolding. I like that. We reviewed some excellent breakdowns of this specific mechanism from Dr. Brian Harmich in Cleveland and Dr. Andre Levesque in Austin.
Both fantastic surgeons.
Yes, and they explained that in a traditional SMAS facelift, the surgeon separates your delicate skin from that underlying durable SMAS scaffolding.
Right.
Then they manipulate the SMAS itself. They might tighten it or they might plicate it.
Which is a medical term for folding the tissue over itself and suturing it securely to create a lift.
Exactly. Usually they're pulling this fibrous layer in a lateral or diagonal direction, so like up and back toward the ears.
Yes, pulling the scaffolding up.
And once that internal foundation is firmly secured, they can gently redrape the skin over the top without having to rely on extreme tension.
The scaffolding does the heavy lifting, not the skin.
Right. And for patients who are dealing with mild to moderate signs of aging, particularly those whose main concerns are isolated to the jawline and the early formation of jowls, well, the SMAS facelift is still considered a highly effective, deeply reliable tool.
Absolutely. It's the workhorse of the industry.
And our sources highlight that there are some very real practical benefits to the SMAS technique. It generally boasts a shorter recovery timeline for the patient.
Oh, definitely.
You are typically looking at around 10 to 14 days before you are ready to be seen at normal social activities.
Which is relatively quick.
It is. It also usually carries a lower upfront cost. Plus, it has a robust safety profile compared to going even deeper.
Yeah, a recent 2025 systematic analysis actually quantified that safety profile.
Oh, right. I remember that study.
Yeah, it highlighted that the SMAS technique has a slightly lower overall complication rate, sitting at around 10.3% compared to the more invasive, deeper techniques we are going to discuss.
This raises an important question, though.
Okay, what is it?
If the SMAS facelift is so effective, if the scaffolding is doing the heavy lifting, and it has such a solid safety profile, why does it still sometimes fail to look perfectly natural? Like, why do you occasionally see patients who still look slightly pulled or artificially tightened after a SMAS lift?
Well, the fundamental limitation of the SMAS technique is its reach.
Its reach.
Yes. It primarily targets the lower third of the face and the jawline. Because the SMAS lift does not actually cut or release those deep retaining ligaments that anchor your facial tissues to the bone, it often completely misses the midface.
Oh, so the cheeks get left behind.
Exactly. It struggles to adequately lift the deep nasolabial folds, those heavy laugh lines that form around the mouth.
Because the tethers are still there?
Right, because the underlying structural tethers holding those specific tissues down are left completely intact. You are pulling the scaffolding, but the internal anchors are fighting back.
Fighting the lift. That makes so much sense. So because those retaining ligaments are left intact and fighting back, the very top echelon of surgeons realized that to achieve true natural harmony across the entire face, from the jawline all the way up through the cheeks, they needed an even more profound release.
They needed to sever the tethers.
Exactly. Enter the deep plane facelift. This is where Dr. Shim Ching's expertise really shines.
He's a master at this.
He is. So the deep plane technique goes entirely under that SMAS scaffolding layer.
The defining critical surgical maneuver of the deep plane facelift is the literal cutting and releasing of those retaining ligaments.
Which one specifically?
Well, we are talking specifically about severing the zygomatic ligaments near the prominent cheekbones and the mandibular ligaments down along the jawline.
Okay.
By carefully, methodically releasing these biological tethers, the surgeon completely frees up the entire facial structure.
So nothing is holding it down anymore.
Right. This allows them to lift the skin, the deep fat pads, and the underlying muscle together as one single, unified, composite flap.
Wait, I have to stop and genuinely push back on this because the logic here sounds incredibly counterintuitive.
How so?
Well, you are telling me the surgeon is going significantly deeper into the face. They are actively cutting ligaments, operating far closer to the facial nerve, and performing a much more extensive invasive surgery.
Yes.
But somehow, all of this extra tissue trauma and deeper surgery creates a less operated on look. Walk me through the physics of that, because on the surface, it makes no sense. How does doing more surgery equal a more natural result?
It is entirely counterintuitive. You are pointing out exactly what Dr. Harmich refers to as the paradox of facial surgery.
Paradox, yeah.
To understand why it works, you have to look at how the physical load is distributed.
Okay.
In a deep plane lift, because the entire structural foundation, the muscle, the thick fat pads, the skin is left attached to each other and lifted vertically as one single massive unit. There is absolutely zero tension placed on the skin itself.
Zero tension.
Yeah.
Wow.
The skin is just coming along for the ride. It isn't being asked to support single ounce of weight. And when your skin isn't bearing weight, you don't look stretched. You don't look pulled.
Because it's not actually pulling the surface.
Right. Once the recovery period is over, the patient doesn't look like they had their face forcibly tightened. The deep tissue has simply been repositioned to the exact geographic location it occupied a decade ago.
That vertical vector makes total sense when you frame it that way. Gravity pulls us straight down. A deep plane lift pulls straight up, reversing the exact path of the aging.
Precisely.
Now, we do need to ensure we are representing the full scope of our sources because the medical community is rarely unanimous and surgical approaches are constantly debated.
Oh, there are always different schools of thought.
Right. There is an interesting Italian study we looked at by Dr. Mariani and his colleagues, and they actually advocate for a specific variation called a high SMAS lift over the deep plane.
Yes, the high SMAS.
They argue that with the deep plane technique, the SMAS flap that is mobilized is somewhat shorter and typically pulls in what they call a superolateral vector.
To visualize a superolateral vector, just imagine pulling the tissue up, but also slightly outward toward the top corner of the ear, or like the upper corner of the room, rather than perfectly straight up toward the ceiling.
Right. And Dr. Mariani's team suggests that this angled vector might sometimes have a slightly lesser or maybe less durable effect on restoring mid-face volume over the long term compared to their specific high SMAS technique.
Because with high SMAS, they actually enter the tissue much higher up over the cheekbone to capture that volume.
Exactly.
It is a completely valid perspective and a testament to how heavily debated facial geometry is among elite surgeons.
Oh, for sure.
The high SMAS technique is explicitly designed to aggressively capture and reposition mid-face volume. However, looking across the breadth of our research, we have to acknowledge the overwhelming consensus from our other leading sources.
Like Dr. Ching.
Yes. Dr. Ching, Dr. Harmich, and Dr. Arda Kuguven. They maintain that the deep plane's ability to actually physically sever and release those deep retaining ligaments makes it the absolute gold standard.
Gold standard?
Yeah. By completely freeing the tissue from the bone, you allow for a genuinely tension-free repositioning. The high SMAS still leaves those ligaments attached, which means it still relies on overcoming some element of internal tension. A limitation the deep plane simply sidesteps.
But simply knowing the right technical approach isn't enough. As Dr. Ching repeatedly points out, performing a facelift isn't just a mechanical step-by-step procedure.
Not at all.
It requires immense, almost instinctual artistic judgment. That aesthetic judgment is the only thing that separates a breathtaking, invisible result from a surgical disaster.
Because the technique is merely the tool in the surgeon's hand.
Yeah.
The surgeon's eye, their understanding of proportion and identity, dictates how that tool is wielded.
Here's where it gets really interesting. Yeah, Dr. Shim Ching actually lays out a very specific playbook of common mistakes that completely ruin a natural look.
Oh, the playbook of mistakes. This is crucial.
Let's break these down because understanding the failures perfectly illustrates why getting this right is so difficult. First on his list is pulling tissues in the wrong direction.
Which goes back to those vectors we discussed.
Right. As we mentioned, gravity pulls the face straight down. If a surgeon takes those tissues and pulls them straight horizontally backward toward the ears or pulls them at severe angles against the natural aging vectors, they create bizarre alien angles.
You get those stretched feline eyes.
Yes, incredibly widened, Joker-like mouths, and that classic telltale windswept appearance that just screams plastic surgery.
The second major mistake in Dr. Ching's playbook is ignoring the neck.
Ah, yes.
This is an absolutely crucial point of failure. The human eye evaluates the face and the neck as one continuous, unbroken aesthetic unit.
They belong together.
Exactly. If a surgeon tightens and rejuvenates the face beautifully, but leaves an aged, loose neck with heavy, visible muscle banding right underneath it, it creates a profoundly jarring visual mismatch.
It's like two different people stitched together.
Yeah, the human brain instantly recognizes that something is synthetically wrong. The stark contrast between a smooth, youthful cheek and a sagging neck makes the entire surgical result look artificial.
The third mistake Dr. Ching highlights is overfilling. And we see this constantly today.
Constantly.
Patients desperately try to avoid the operating room by pumping their midface full of dermal fillers or fat grafting. Or, sometimes even after a facelift, a surgeon will add far too much filler trying to artificially perfect the contours.
Which is a huge mistake.
It invariably results in a heavy, puffy, inflated look. The face begins to look rounded and swollen, rather than restored and genuinely youthful.
That inflated, pillowy look is the exact opposite of true rejuvenation. A phenomenal facelift, performed by a master of the deep plane, restores harmony.
Right.
It deeply respects your original, unique identity. You shouldn't lose the nuance of your natural smile, your specific character lines, or the distinct features that make you look like you.
The surgery shouldn't turn you into someone else.
Exactly. It should simply reveal the underlying geometry your face naturally possessed years ago.
And getting that deeply personal aesthetic harmony right leads directly into the ultimate payoff for the patient, which goes so far beyond just the physical alterations. It's about what we call the emotional return on investment.
The psychological weight of this procedure and the emotional relief it can provide is truly profound.
Dr. Shim Ching has this wonderful philosophy that drives his practice. He says that when it comes to plastic surgery, the return on investment, the ROI, is a deeply emotional issue.
Oh, absolutely.
The goal of spending this time, money, and recovery isn't for your friends to lean in at a dinner party and ask, "Oh, wow, who did your surgery?"
If they ask that, the surgery fundamentally failed to look natural.
Right. The highest, most coveted compliment you can possibly receive after a facelift is simply, "You look so rested," or "You look incredibly healthy. Did you change your diet?"
Yes, that's exactly it.
It is about getting to a mental place where you feel like your internal energy, your vitality, finally matches the external reflection when you look in the mirror every morning.
And that emotional ROI is heavily tied to the longevity of the surgical results. When we compare the overall timelines between these techniques, the differences become stark.
Oh, let's talk timelines.
A well-performed SMAS lift generally looks great and holds its shape for about 5 to 10 years.
Okay, 5 to 10.
But a deep, plain facelift, precisely because of that profound structural repositioning and the complete release of those deep ligaments, lasts significantly longer.
How much longer?
Patients typically enjoy the results of a deep plane lift for 10 to 15 years.
Wow, that's a big jump.
It is, because the core foundational architecture of the face has been structurally reset to a higher position. It actually ages much more naturally alongside the patient moving forward.
Okay, I am entirely sold on the aesthetic result of cutting ligaments and lifting the deep structure, but my brain immediately goes to the aftermath.
The recovery.
Yes. Doing deeper, significantly more invasive surgery has to mean a brutal, agonizing recovery process, right? We pulled recovery tips from Dr. Ching, supplemented by clinical insights from Dr. Dimitri Arnotakis and Dr. Stephen Perkins.
Right, and the recovery might surprise you.
It really does. Interestingly, while the deep plane recovery does take slightly longer overall, you are looking at roughly 2 to 3 weeks before you are really socially ready to be seen without obvious swelling, compared to the 10 to 14 days for a superficial SMAS lift.
Right.
It can actually feature significantly less bruising.
That is one of the most fascinating anatomical quirks of this procedure.
Seriously, how is there less bruising with more surgery?
Because the surgeon is dissecting beneath the muscle and moving the tissues in the deep plane as one thick, undisturbed unit, they are actually preserving the delicate, natural blood supply and the microscopic lymphatic drainage pathways that live within the skin itself.
So the skin's blood supply isn't cut off.
Exactly. The skin isn't being violently separated from its blood source. That preservation drastically reduces the severe, dark bruising you often see with more superficial techniques that disrupt the skin layer.
That makes total sense. And the modern recovery protocols have also evolved light years beyond what they used to be. Our sources detailed the specific aids that surgeons now use to optimize the healing environment.
The post-op care is amazing now.
Instead of waking up wrapped in those awful, choking mummy bandages of the past, patients are often given specialized jaw bras that provide comfortable, targeted compression.
Jaw bras, yes. They make a huge difference.
And surgeons like Dr. Arnotakis routinely utilize medical-grade hyperbaric oxygen therapy chambers and targeted LED phototherapy in the days immediately following surgery.
Which is brilliant.
Right. It floods the healing tissues with pure oxygen, encourages massive blood flow, and accelerates cellular repair at a microscopic level.
The surgical techniques themselves have also evolved specifically to make the patient's recovery smoother at home. For instance, Dr. Perkins noted the modern widespread use of Tecile fibrin sealant.
Oh, the biological glue.
Yes, it is essentially a specialized biological surgical glue used to adhere the deep tissue flaps securely down internally before closing the incisions.
And the relief that biological glue provides to patients cannot be overstated. I mean, in the past, surgeons had to leave plastic tubes, surgical drains, actually sticking out of the patient's neck to prevent fluid buildup under the skin.
It was incredibly uncomfortable.
Patients had to go home and manually empty bulbs of bodily fluid for days. It sounds horrible. But by using this fibrin sealant to glue the tissue down seamlessly, surgeons can often completely avoid the use of those painful, anxiety-inducing drains.
It transforms the entire psychological experience of the recovery.
It really does. So what does this all mean? We have traced the incredible century-long evolution of this procedure. We have moved from the tight, tension-filled, disastrous, skin-only mistakes of the early days. We progressed to the highly reliable foundational approach of the traditional SMAS lift. And finally, we arrived at a tension-free, vertical structural restoration of the deep plane facelift.
It's been quite a journey.
It really has been a long journey, from merely pulling the fragile surface to actually masterfully rebuilding the architectural foundation of the face.
If we connect this to the bigger picture, the deep plane's unique ability to reposition those deep structural elements without relying on skin tension is the exact mechanism that ensures you don't look artificially tightened.
Because it's a structural reset.
Exactly. You look genuinely, authentically rejuvenated. And that is what ultimately secures that crucial emotional ROI we discussed. It simply allows you to recognize yourself again.
Which brings up a really fascinating, perhaps philosophical point for us to leave you with today.
As these surgical techniques become so incredibly advanced, so deeply anatomical, that the final results are completely undetectable to the naked eye.
Yeah.
It makes you wonder.
Wonder what?
Will society's lingering stigma around having work done eventually permanently vanish? If truly no one, not even your closest friends, can tell that you actually had surgery, does the whole noble concept of aging gracefully just become a matter of having access to a truly great surgeon?
Thanks for listening to the Plastic Surgery Playbook.